So welcome again to another podcast of the Project Cancer. Today we have Sheila Marshall, who I've known for probably about 8 or 9 years. I've known her husband about 13 years and worked together with her husband for all that time. Sheila's had her own cancer journey, and because of that she's moved on to set up a resource, an exciting resource which I'm involved with as well as a patient, called Butcher's Bear. So Sheila, can you talk about your cancer journey first?
Yeah, absolutely. So in May 2017, it's quite hard to imagine that it was that long ago now, I went for a fairly routine health check because I'd had one 5 years before, and I thought, it's 5 years, I'll do another one. I took a health check with Bupa, and the sales guy, an Irish sales guy, convinced me to have a mammogram, and I was 40, so I thought, well, I don't really need one. In the NHS they start at 50, but he was quite insistent I had one, and by the time they had finished the mammogram, it felt very obvious there was something wrong. The lady had gone to the front desk, she was asking for a doctor, and I thought, Christ, I hope that's not about me. And of course, you know, it very quickly transpired it was. And actually the day I got the call, I was in my husband's office doing a workout. I had a PT who was helping me at the time to get fit post the children. I was very fit after a year of having weekly training sessions, and the phone was hopping off the hook, somebody trying to get hold of me to tell me. So they told me. She found it, I think, very difficult to hear and left shortly afterwards. And then you called me about a business that I'd been going to board meetings with you and shadowing in the construction sector. And so I found myself telling you as the first person that I actually vocalised the words, I've got cancer. And it's, you know, even now today, I don't know if you have this, Peter, but even now to say that is really hard because we imagine, you know, those words that somebody has cancer is really strong and serious and terrifying. And I was bloody terrified. And, you know, with your first wife having had a cancer journey too, you totally understood it, and
absolutely.
It was
the same cancer, twice in fact in her case.
Exactly. And it was really reassuring to me. So we had a very special moment, and when Robert came home that night and I told him, he said, you know, crumbs, and I said, well, I've told Peter, and it's just ironic that you were the first person. Then here we are all these years later. So that's how the diagnosis happened. Okay. It was, I didn't have symptoms that I knew about. I think on reflection there were things, but because I'd had 2 children within a year, and I was, you know, having breastfed, there would have been some changes in my breast that I had put down to the fact that I had finished breastfeeding and that it was to do with that, so I'd ignored it. So very fortuitous that I was picked up. It was deemed to be stage 1, it was downgraded to stage 0, so it was very early stage, but it was a very aggressive form of breast cancer. So it did mean that led to chemotherapy to shrink the tumours so that they could operate. So 6 sessions.
So they had to do that first, they did chemo to shrink, and then they...
Exactly.
And tumours, you mentioned tumours.
I don't know, you know, even now I'm slightly, you know, I went la, you know what you're doing, and I don't want to hear too much, so there was very little I could hear. It was only actually years later that at a dinner at Trinity, when a scientist mentioned that one of the drugs I'd had, Herceptin, that was invented by his company Bicycle Therapeutics, that I actually realised that had I presented perhaps 10 or so years earlier, there would have been no treatment plan for me. It would have been 3 or 4 months, that would have been it. And that in itself I found quite terrifying. But they put me through sort of 6 to 8 rounds of chemotherapy. I then had my surgery, mastectomy, reconstruction, 14 hours of surgery. Incredible surgery, because I think you get a really good end result when you are young family.
And this is where the reconstruct from the stomach.
Exactly.
Isn't it?
So it's called a Dieppe flap. So they take both fat and skin grafts from the stomach and reconstruct the breast, and it looks, you know, very, very good. It's a really, you know, we are blessed. Years ago this wasn't deemed to be necessary for breast cancer patients, and now this is kind of fairly standardised.
Yeah.
I then went on to have 3 weeks of radiotherapy, and then for the rest of the year.
On what though?
On radiotherapy on all of the sort of on the area around. So I did. It wasn't in my lymph nodes, but it was a wash of radiotherapy across the breast.
Yeah. Even though that's after the mastectomy.
After the mastectomy, because they're looking for. They're looking obviously for clear margins, but even around that margin site, they want to make sure that there's no stray cells, and if they are, that they are treated. So, and I actually found radiotherapy really hard, even though it's not like chemo where it's tiring and exhausting. I found it mentally quite draining, and I found it really emotional sitting in Addenbrooke's waiting. The machines go down quite a lot, or they used to when I was going through. So I would talk to a lot of people, and you see a lot of suffering, and I had this overwhelming sense that whatever I was going through, there was a lot worse going on around me. And I think it was only then that I realised the scale of the emotional side of cancer and how impactful it is to the people and their family and their friends, as I spent hours waiting. It was the week before Christmas, and then I had Christmas Day, Boxing Day off, and then I was back in afterwards. I think I'm probably one of the few people who turned up to radiotherapy half on Christmas Eve.
Well, that's probably easier for you. Yeah, I've just had radiotherapy 2 hours ago, actually. My 3rd session. So.
How was it?
Didn't say really, because it's very quick. It's very high intensity, so it doesn't take very long. The actual beam is only on for about 4 minutes, and it rotates around the body, so it attacks from various directions.
Right.
I'm going to do another podcast about that, a private podcast, no, not private, on YouTube in the next week or so.
Were you tattooed for that?
No, what they do is they take a CT scan, and then they measure that, and they put me on the bed and move me around a bit, and then they do a scan again, and they move me around again.
To get your position.
Exactly,
right,
and then they mark me up with felt tip, not with actually anything in my body, to get it exactly right. Bearing in mind that my tumour's about that sort of size an egg, it's not, they want to cover all of that, but they also, of course, in the same, unlike you actually, because you had to have a blanket area, they didn't want to touch my intestines specifically, because that's very close. Yeah.
And of course that's another part of radiotherapy, that there is, late stage effects of radiotherapy.
I'm told tiredness, pain and diarrhea are the ones that I might expect. None of those have happened yet, but I'm only 6 days into this now, so
it's going,
so that was Christmas. So what about, how old were your kids then?
Kids were 1 and 2, so that was, and I was, I don't think that, I hoped to God that I would make it through, but there were some difficult times, and you stay as positive as you possibly can, but there are doubts obviously that creep into your mind. And that Christmas was, I wanted to be as upbeat as possible, but at the same time I was slightly terrified. And
well, I'm not surprised. You don't need to excuse that, do you, at all? I just wonder how the kids were reacting to it. Were they aware? They're almost too young to be aware.
They when I lost my hair, so then they would say, it was actually after my mastectomy and reconstruction. I couldn't drive for 6 or 8 weeks. They were at nursery school at the time. So Robert had a colleague from work who was able to support me and come and give me a lift in the morning to get them to nursery. And he is slightly follically challenged. So the kids would say, "What's going on? Roy's got a bald head, Mum's got a bald head, everyone's got a bald head." And he'd say, "Shut up and go in the car." And he'd wrestle these kids into the car. So they did sort of talk about why I had a bald head, but I never really explained it. And they were so young, we didn't need to.
No.
And now, when they've seen the pictures of me now, they look back and say, you look like a bloke. Why did you look like a man? They say. And very kind. I'll tell you one quick funny story though. My nephew was, my great nephew was, he must have been about 8 when I was bald. And when my mother he would arrive with my niece and my sister and my mother. And my mother is Irish from the Black Valley, and in Ireland, if you got cancer, that was it. It was a death sentence, and it was very quick. There was very little treatment. By the time people discovered it, it was all too late, and that was it. This is very sort of rural Ireland, and so we as a family said, well, let's not say anything to Mum. She won't be able to cope with it. She'll assume the worst. So we said nothing, and I had a nice wig that I put on when she came.
So you didn't notice?
So she didn't.
Well.
But she did. She used to say to me, "Sure, you're anemic. I know you're anemic. You've low B12. You've low iron. You need some help."
By looking at your skin. Yeah,
so she could see there was something wrong,
yeah.
and she'd say, "What the hell's wrong with you?" But we just put it off as being slightly unwell, and then. Kobe came in, so Kobe had only ever seen me in the week. He wasn't told in case he blabbed. And he ran into the room one morning to see the kids, and there was me in the bed with the bald head. So he looked like this, and he backtracked out of the room. And he said to my mum, "Sheila's got no hair." And I came downstairs and she went, "Jesus, the boy's mad." So poor Kobe.
But she clicked then, did she?
She didn't, no.
Okay.
She thought the boy was mad, and that was it. And then it must have been 8 or 9 months after I finished treatment, the day of my surgery, I was down for over 12 hours, between 12 and 14 hours by the time I was in high dependency. And I'd said to Robert, whatever happens, don't say anything to my mum. And she called him off the hook all day saying, "What's wrong with Sheila? I know there's something wrong with her."
Exactly,
And he was, just broken by not telling her, but he didn't. And then about 8 or so months after I finished, she said, "I know you might have had that thing, and you're better now, aren't you?" And I said, "I am, Mum." And she said she'll never talk of it again. So,
oh, that was it. Okay.
So we've never said another word since.
Oh, right,
and that is definitely a sort of old Irish Kerry way, I would say.
So that was into 2018. You then go through a recovery period. How did you do that? Who did you use for that? What advice did you have, etc.?
So I think I was fairly cross, to be honest. By early January, I thought, right, kids are 1 and 2. I could barely lift my arm up here with the searing pain. So I knew I needed full rehabilitation. I went back to Adam Brooks and basically asked for it. I was introduced to a very good program called React. I can't remember what it stands for.
Oh yes, I've heard of that. I've not been on it, but I've heard of it. Yeah.
And it's a lot of good education about the benefit of exercise, good nutrition, mental well-being post-cancer. But of course, there was very little funding, so there was not much they could do by way of implementing it, except pull out those that were most in need.
Yeah.
So the rest of us were told it's a really good idea to exercise and all the rest of it. But I think it's that funny thing, isn't it, that you need to do it, but you can't quite imagine having had a year of all of this.
Yeah.
And as my kids described, I now look, from there like a fat bloke, basically. And the thought of going into a gym like that was terrifying.
Oh, right, okay.
And I went back to the Nuffield and spoke to their oncology director and said, "Look, what do we do? I really would love to do something in a profound way." And she was the oncology manager who worked for the oncology director, Hugo. And she said, "I can get some grant funding, let's write a paper." So she wrote a paper for some grant funding. I think we got about a couple of £1,000. We used that with some money I had to pay for some of the Nuffield's gym personal trainers to be trained in level 4 cancer care.
Okay.
And then they put me through the program.
Yeah.
So we put me through 12 weeks of exercise interventions. And even though I wanted it, I was still, I think, a really difficult patient. I would turn up and be, on reflection, I think that from a mental health burden, it was far greater than I realised at the time.
Right.
So there were times I would turn up and just not want to engage, even though I kind of wanted to. I was cross.
So you still turned up, because in that sense, many people wouldn't even turn up, would they?
Yeah. And it was, she would message me 6 times a day to try and get me onto it. "What time are you coming?" And I'd be, not really wanting to go. But I found myself going, and reluctantly, sometimes I'd say I'm coming for a chat, and I'd go in a dress because I thought I'm not going to exercise, but I just have a chat. I went through all of those hurdles, and then over the course of 12 weeks I found she taught me how to use all the gym equipment, how to do a proper workout, how to move properly and build my core strength. So of course my stomach from a course was destroyed, so it was amazing, really amazing. And then I went back to the Nuffield and said, well, how do we do this now for others? So we then...
So did you have any psychological help, any counselling during this period?
I not through that.
No.
Through privately, I saw a lady in Cambridge, and she was fantastic. And one of the things that I had, the specific reason I went to see her, that I was finding the most difficult, was that I was terrified that everyone else was going to get cancer. So I had this fear of, you know,
Being contagious? Or?
No,
Oh,
no, as in that, you know, it was there in our world, and it was a
Okay.
risk to people
Yeah,
around me, my
okay.
family and friends, and I thought we should all be changing our diet and
Yes,
exercising
okay.
more, and I just had this awareness that we should all be changing our lifestyles
Yeah, sure.
to stop us getting cancer. But it became slightly overwhelming, so that was my main driver to see her, and I would worry about, you know, other people getting cancer and that them going through that trauma, and then I got worried about her,
Yeah.
which was
The counsellor themselves.
Yeah,
Some
but
sort
there's
of
sort of-
transference there
I know.
floating around.
so she was saying, you know, this is why you're here, isn't it? And I said, but this is, I think there's something wrong. You don't look right. And unfortunately, there was something wrong, and
Oh,
she
but-
died a few months later. of
Oh my
cancer.
goodness.
And it, yeah, and that obviously did nothing
Nothing
in
at all for
terms
your
of
mental health.
alleviate my fears. But and this is what led it to this drive of, if there is a way of supporting the cancer patients. So I went back to the Nuffield, we got a bit more funding, and then we put on these weekly classes, and it was a graded return to exercise, complete, you know, mobility of this joint for where people had their mastectomy,
yeah.
which was the most important bit. I'll come back to the community bit because I hadn't realised the power of that until much later. Then from a mental health perspective, our first courses we worked with Be Mindful, and they gave us online mindfulness, which we were using as a way of, you know, just
So
offering
it's
something.
you and the Nuffield together, working
Yeah,
together.
so we were working together, and then the Nuffield's dietitian gave dietary
Yeah.
advice, and we gave weekly recipes. So that's how we delivered the programmes in the first days. We had a number of groups come through. Dame Sally Davis came to some of our exercise classes,
Oh,
hugely
yeah.
supportive, with ITV News, and then, you know, at some point in that journey, when we looked at how we would scale it, we opened one in Oxford. It's quite difficult for me. I was
group?
travelling
Oh, you actually
an
helped with
exercise
it?
class in
Oh,
Oxford
goodness,
at the
yeah.
Nuffield there. I was sort of 2.5 hours. Well, Robert tells everyone that it takes like 4.5 hours to get from Cambridge to Oxford, but that's because I would go to the Vista Design Village
Oh, right. A
for 2 hours.
bit of shopping on the way.
Bit of shopping.
And back, on the way back as well.
So we did that, and it was more difficult because
Yeah.
here I had the media backing. So Susie on the
Susie
radio,
Thorpe,
Susie
yeah.
Thorpe was
Yeah.
supportive of put me on the radio. It was in the Cambridge papers, whereas to try and repeat that in Oxford I was finding quite difficult.
Did the Nuffield would connect you with patients, though, wouldn't they?
They did.
Surely.
They
Yeah,
did.
yeah.
So they had a few patients that they were connecting us through. They then had a strategic decision to make as a group. They were either going to invest in cancer rehabilitation or joint pain.
Yeah.
And they went with joint pain.
Okay.
So at that time, we decided that I would continue it and do it myself. And they would
Not at the Nuffield, though.
not at the
No,
Nuffield.
okay, yeah.
So we left, so we ended our agreement then, and I think it had been difficult for the Nuffield group as well, because, and I think fair enough, because we had a number of women who had, you know, from a mental health perspective, some you know, signs of clinical depression, things like that,
Okay,
and
yeah.
the behaviours then in their gym were sometimes difficult,
Yeah.
and they didn't like it because they had paid members, whereas I'd convinced them to give this, you know,
Yeah,
free
okay.
membership to the
Yeah,
gym
sure.
for 3 months. So it was always slightly challenging, and then we decided we would go our separate ways. I had a workshop then. You didn't come to it, did you?
I
don't
didn't,
think.
no.
But it was, so David Gammon came. We were looking at how would we scale this, how would we deliver it on a
Yeah.
platform with an app, would it work, would we keep these rates of adherence, would we still be able to create the community, because off the back of all of this, the women who came to the programme found themselves in an incredible community of like-minded
Yeah, sure.
people, and they would see each other for art classes during the week, to go for walks, to go to the gym. So they got
How many were there? Sort of.
14 in a class, 12 to
yeah.
14, which was a great number. And we still have WhatsApp groups. We still walk on the meadows together. So we have walking support groups, and it was utterly brilliant. So how do you scale that and still create this sense of community
Exactly.
and keep the adherence and the feeling of it being personalised? So the workshop said yes, it should be possible, and I then raised our first pre-seed investment round, family and friends round, of 750,000 to be able to.
And the company's called Butcher Spare.
And
Could
that
you
became
explain
Butcher Spare.
why it's called Butcher Spare?
Well, we started as bosom buddies because it was
Okay.
breast cancer.
Yeah.
And by the time Dame Sally Davis came, we had people with bowel cancer, cervical cancer, we had men with prostate cancer that we were looking after. And when the news crews came and I gave everyone their t-shirts, they were saying, well,
Yes.
this doesn't mean anything to me. I'm not, it's not,
Yeah.
the name's not right. And I was just put the t-shirt on and dance. We'll sort it out later. So I said, right, tomorrow, the name is changing. And
Yeah.
we were at this table with my kids and I said, what name do you think it should be? It can be something completely random. And my daughter said, why don't you name it after him? And she pointed at my son. He's Isaac Butcher's Bear. So that's how we ended up there.
The bear as well is.
He's Butcher's Bear. Robert was at college with a chap called Bear.
Okay.
So
yeah.
they were great mates at Pembroke. So
Okay,
that's
yeah,
where the bear
that's
came
better.
from.
Okay, brilliant. Okay.
Yeah.
So you've raised some money. We won't talk at length about this. Isn't an investment, but
Yeah.
what I want to understand is what is offered by the program and how that's helping people.
So the program is those things that we talked about that were really important, learning how to stretch, move post-cancer. We might imagine even at athlete level or somebody who hasn't had much experience of exercise, you could get back to it, but it's actually, I think, very difficult. So it's baby stepping people as a graded return to exercise and getting people comfortable to move the site where they might have had treatment, they might have had surgery, and getting comfortable knowing they're not going to pull something. So there's a lot of early physiotherapy delivered online. And from that, and it's also importantly the early stretches. So when the surgery is first done, the sooner that one, in the case of a mastectomy, can walk your hands up the wall and start moving away like this and getting movement through,
Right.
the greater the full return to mobility is going to be. So we introduce those exercises very early. They're all pre-recorded, so people can do them in hospital.
That you pre-recorded. What did you? The program I was on actually had a face-to-face. I had a weekly a Zoom connection with a great guy, Richard, who was helping me.
Yeah.
What part of the program is that?
So there's a mixture of the weekly health coaching call. So this is the very deeply personalised bit where our health coaches get to know the person. So some of whom will be undergoing active treatment, and some people who will have finished treatment. But they will have a weekly call to understand what exercise habits the person had before. So obviously in your case it was brilliant.
Yeah.
Exercising at very high intensity, running marathons.
Well, half marathon.
Half marathon.
Yeah, I was
So-
already pretty active anyway. Though of course the cancer did affect me. I didn't do any cycling for 3 months. Never mind any running. That took about 4 months. So I had a long way to get back up actually.
Exactly, and
Yeah.
this is very commonplace, and for some people that can take years.
Yeah.
And for people who perhaps haven't done much exercise pre-cancer, they want to because they've
Yeah.
seen all of the research of reduced rates of reoccurrence and keeping it at bay, but it's very hard to get back to that. So this weekly coaching is a lot about building trust. I think a lot of it is, in a healthcare system, be it private or the National Health Service, when one finishes an active cancer treatment, a lot of people report feeling like they've fallen off the end of a cliff because the services have to stop because there's more people coming through.
Yeah, sure.
Where do they go?
Yeah.
So as much as anything, our role is to support people mentally and physically as they rework out their lives going forward
Yeah.
and support them to recover. So a lot of it is, I think, a very deep personal relationship of building trust and talking about what does somebody want out of their exercise goals, a bit of educational material about why it's helpful to reduce risk of recurrence, where that data comes from,
Yes.
and sharing the science behind it so that it is meaningful, and then supporting people. And it's all about a lot of behavioural science and positive psychology.
Yeah.
That everything we do is highly beneficial. So this is not a program about trying to get somebody to Ironman. This is a program to get somebody back to their best self.
Yeah. Yeah.
So that's the focus. And I think your experience with Richard was really positive. He's a very personable guy. He himself has talked very publicly about the fact that he had his own diagnosis years
Yes,
ago, which
yeah.
he's overcome. And that he's an incredible role model for
And it's
people.
a specific skill set, isn't it? He's been trained specifically in cancer or oncology,
He's
physiotherapy. hasn't he?
exactly
Yeah.
level
Yeah.
4 cancer care, as well as he's also a lecturer at Suffolk University. So
Yeah.
he's incredibly knowledgeable in the space, and he's been an amazing health coach to us. We also have Nicola, her background is in physiotherapy, so who you've worked with most recently, and so she is bringing to the program. She's also obviously a trained health coach, but her angle is very much on physically moving people through when they might have some form of chronic pain. So she's also a chronic pain specialist.
Oh, okay. And then I also touched on a single session with psychotherapy or counselling.
Yeah.
Do you offer that also? Is that part of the program?
Yeah, absolutely. So must be about 9 months ago, we were joined by Dr. Sarah Bater, who was the leading mental health clinician in IESO. And she joined us with a team of 9 therapists. So now they have written all of the procedures, the inclusion-exclusion criteria, and she triages people people go through an assessment of stress, anxiety, depression, quality of life. She will then triage it and decide what's the most appropriate therapy. It might be an acceptance-based therapy, some form of CBT, and her team will then run that.
IESO is a company here in Cambridge that I'll mention in the show notes, which in fact I'm an investor in, as it turns out. I didn't know that connection.
And it's been fantastic. So she has a chap called Drew who leads it for us. He actually led the IESO program into Scotland and the sort of the islands off the west coast of Scotland in the early days. Incredibly knowledgeable. So we've been blessed to have them as a team.
And then we talk about diets, don't we? Do you offer dietitian advice as well?
So we've got a number of dietitians, and again they meet with the patient, and depending on somebody's needs, it could be a lot of people we direct towards an anti-inflammatory sort of Mediterranean style diet.
Okay.
General philosophy being more pulses, beans, vegetables, as much natural unprocessed food as you can eat, and kind of 80% of the time you're never going to be perfect, and that would be silly. So it's very accessible, I think, in terms of where we're moving people to. Most people will be looking to lose weight post-cancer because the drugs and steroids, things like Zoladex, people put on a lot of weight. That's given for breast cancer patients and prostate. Chronic pain patients also may not be exercising as much as they like, will want to lose weight and get into an anti-inflammatory diet. So we create, the dietitian will create a 4-week meal plan. And the general premises is, as much of it as possible is bulk batch cooking that you then freeze, and it's nuts, pulses, it's all of those things that then you dig out the freezer, and it's easy. So the commitment to it should be reasonably light.
Yes, because you're not, I see. And any other services? We've got diet, exercise, psychology, psychological help, anything else?
So the next one is, finding something that gives you joy, like, some of the things that we probably have lost since childhood. So looking at art therapy, we have a team of art therapists, and they do great classes around freedom of expression, and it's really funny because as adults we so often think, I can't paint, I can't do this, but it's probably just because we don't allow ourselves, and we haven't had somebody teach us the basics. So people can really enjoy that. That's something people can choose to go on. They can choose to go on a 10-week mindfulness course. So it's a stress-based reduction mindfulness program, and these are sort of optional extras that go on over the course of the year, and people then join and pick the ones that sit best with them. There's also Dr. Deepak Ravindran, who's our Chief Medical Officer. He's a specialist in chronic pain, so he has created 12 weeks worth of videos about what's the neuroscience of pain, how do you overcome it, how do you review the medication you're on, is it still serving you, how do you taper off it if appropriate.
But that's not for cancer patients necessarily, is it?
Well, 75% of cancer patients are in chronic pain.
Okay.
Are left normally post-surgery.
Okay. Yeah.
So it's to treat those cancer patients that are in some form of chronic pain.
Right.
And then they get access to the educational side of pain, so that then they can work through it to overcome it. Particularly, a lot of cancer patients who would have had quite serious, opioid-based medication
Yeah.
could have been left on those for longer than is appropriate.
Yes, okay.
I do remember clearing out my cupboards of my liquid morphine with some trepidation.
Because you didn't want to let go
Yeah,
of
because
it.
you feel like,
Well, you
what if
just hide it
something
in the
goes
garden.
wrong,
Yeah,
you know?
exactly.
I want it in case it
yeah.
becomes a crutch,
Yeah.
doesn't it? But, you know, there is a point where you have to say, I'm okay, that
Yeah,
has
exactly.
to go. But
Oh,
it's a
yeah.
funny thing, isn't
Yeah,
it?
yeah.
I think
Yes.
it's, you know, when you're on meds, I think it's very easy to become, to feel that, do I need this? Am I going to be okay without it?
And a question you're probably not expecting, but if this had been available when you were diagnosed back in 2017, would it have made a big difference?
Oh God, Peter, I think it would have. It's, you know, the funny thing is that when I did the first survey for the first 12 people who went through it, I had, you know, like a monkey survey, whatever, survey monkey, and I didn't have a box on there for community. Yeah, it was just
Yes.
what was the best, the exercise, the diet advice, this, that, and the other. And I never had anything about, because obviously I went through it myself, but the people who went through it afterwards have got each other.
Yeah.
And so all of the responses that came back basically all said, this is all great, but actually it's having the other women. It was going
Yeah.
to have coffees and go to the gym, go for a walk on Grantchester. They do art classes together. Some of the women have been to New York during lockdown and got stuck there together. So that is what has been really vital to me in terms of the importance of maintaining community. So wherever we are, we need to be pushing our people together, getting them into group-based exercises
Yeah.
and classes, and encouraging people to meet up, because it's this stuff, it's you and I talking,
Yeah, yeah.
that actually heals. And I didn't really have that. I feel that I kind of went through that learning journey a bit on my own.
Does Maggie's offer that or something?
Maggie's were amazing.
Yeah.
And so they would actually come and see me every week, the nurse.
Yeah.
When I had my oncology at the Nuffield, it was
Yeah.
radiotherapy I had at Adam Brooks, and they were absolutely, utterly fantastic. And not just to me, but they would talk to Robert every week as
Yeah,
well.
okay.
And I think, you know, Robert's sort of thing in life was, it's all brilliant, she's fine. If anyone asked how I was, she said, she's great, it's all brilliant. And of course it really wasn't.
Yeah, yeah.
But they kind of helped him to
Yeah, sure.
face some of the realities in
Yeah,
which
yeah.
we were going through. So I
Yeah.
think that they are absolutely fantastic at that psychological support. But I think that and they, of course, it's the Maggie's concept is all sitting round a table
Yeah, exactly.
and
Group-
chatting,
group work,
and
yeah,
the group
yeah,
work,
yeah.
and we are an extension of that.
Yeah,
I think that
yeah.
getting people together is amazing,
Yeah.
and really. So I would have loved that aspect.
Yeah, sure.
I never actually went into a Maggie's. I saw them at the Nuffield,
Yeah, okay.
and every week in my diary I said I need to go, and I couldn't quite. I was. It's really, you know, sometimes you feel like you don't know how to say to somebody in those early days, I've got cancer. You know,
Yeah,
I
yeah.
found it quite. I couldn't
Yeah,
really.
you were 20 years younger than I was. I looked at it in a different way, and I'm
Yeah.
a man as well. And my kids, you know, your kids are young.
Yeah.
Mine were in the 30s, so yeah.
Yeah, and
different
it's.
feeling. Yeah.
So I do think I would have benefited enormously, and you know, I do think I came at this, not, you know, from a place of almost anger, because I felt that we should have these services.
Yeah.
That, you know, mentally and physically, I felt really pretty broken. I have to say, I was raw in searing pain, but yet I wanted to exercise. I wanted to make sure I stretched. Mentally, I felt like I'd been through a frigging war zone.
Yeah, yeah.
So, and I didn't even imagine that I would ever. I kind of almost look similar now to the person that Robert married, but I still look different to that. I'll probably never go back to that, and that's that. You know, I don't know. It's a bit of ego or whatever the frig it is, but not being able to recognise the person who looks back at the mirror is really something. I think as a woman, and losing your hair. I think the oncologists find this like, oh my goodness, when you say, oh, am I going to lose my hair? They think we're fighting for your bloody life here,
Yeah,
and you're worrying about your frigging
Yeah,
hair.
yeah.
It's the least of your worries, but for a woman, it's a real
Same,
thing,
yeah,
because you
yeah.
don't know who's looking
Yeah,
back,
yeah,
and
yeah,
so, yeah, I feel like it would have been amazing if I'd have had that support and a bit of guidance and a bit of reassurance that I was going to be okay.
Yeah, yeah.
Although, you know, I have to say also, I did feel and still feel incredibly blessed by the, you know, loving care that was delivered by both the oncologist and the surgeon Dr. Pato Ferrari was my surgeon, and I still see him now. So I see him once a year now, and I adore him. You know, in the man has literally saved my life, and I have absolute adoration. And I often, you know, I practice gratitude every day. And one of my most grateful things in the world is this team of people who put me back together and saved my life. And that I, you know, I don't think a day goes by where I don't spend a moment thinking about that.
Excellent. Well, thank you very much, Sheila. You've been through a lot, particularly with such young kids, and you're giving a lot back now. So
thank you
very much indeed.
Thank you, Peter.
So we'll put this up online very soon. I will also put Booters Bears details online. If you want to get in contact with Sheila, you'll be able to do that. Thank you very much.